Hey, I'm Vic Senese, and this is UroNurse News. Today, we're taking a closer look at a surprising trend in healthcare, the rise of emojis in healthcare records. At Michigan Medicine, clinicians are officially instructed not to use symbols in patients' records. Yet, a recent survey of the system's electronic medical records uncovered thousands of emojis hidden in messages to patients, visit summaries, and post-visit instructions. Most of these symbols were familiar smileys, the classic, smiley that topped the list. Other emojis, like the eye for an eye or a pill for medication, have been used to represent symptoms or treatments. But some emojis were far more mysterious and difficult to interpret. Emoji use in clinical records are still very rare. According to a published study in JAMA Network Open between 2020 and 2024, fewer than 2 notes per 100,000 include emojis. So let that number sink in. However, the trend appears to be growing. Let that sink in. By the last quarter of 2025, researchers found emoji in more than 10 notes per 100,000. That's a significant increase, and it raises important questions about clarity, accuracy, and patient safety. Let's break it down. Emoji could add a new layer of meaning to clinical notes, quickly showing mood, reminders, or instructions in a visible, intuitive way. But they also bring risk. Interpretation of an emoji could lead to errors, confusion, or even improper treatment decisions. The study's authors caution that while emoji might humanize medical communication, healthcare providers must remain careful. In fact, the official guidance at Michigan Medicine still discourages their use in patient records. So is this trend a harmless innovation or a potential risk in patient safety? Experts say it's a little bit of both, and the conversation is just beginning. For now, emojis remain rare, but they may be slowly finding their way into medical lexicon. And as electronic health records evolve, healthcare systems will need to decide whether these symbols belong in the serious business of patient care. Hey, are health tips you're watching online actually backed by science? Tomorrow on UroNurse News, I dive into a new study showing that most medical claims in physician-created videos lack strong evidence, and the videos with the weakest evidence are often the most popular, unlike this show, which is evidence-based. Find out why popularity doesn't equal credibility, and learn how to protect yourself from misinformation in digital health content.
Oh, UroNurse News, let's learn and share on YouTube, LinkedIn, X, and Facebook, everywhere. 5 minutes of wisdom for patients and peers, bringing urology info through